Okay, everybody. Thank you for showing up to our monthly stem cell webinar. I'm Dr. Richard Kim, and this is how stem cells solve pain. I like to get started right on time and get going. Eric, I see you've already raised your hand. I'm going to try to get through all of this and then get to the questions at the very end. Let me just see. So if you check in your uh, box there, the Q&A, I believe is on the bottom right, if I'm not mistaken. There's a Q&A button, and then you can ask all of your questions, and then we'll go from there. All right. So basically, we'll start off with a Q&A from Daniel S. from area code 425, who's asking about treatment for arthritis. And that's exactly what we plan to go over here. We want to talk about exactly what regenerative medicine is, but we also want to talk about who regenerative medicine can help. And of course, there's a lot to go along with that conversation. Mitra H from area code 514 asks, I have lower back pain, cannot do some sports, only swimming is helpful. Do you have any solutions for me? I'm a 52-year-old lady. Yes, we can help. It's non-surgical, what we do. It's not a medication-based. But the important first step is diagnosis, and knowing why do you have back pain is part of this. And of course, for us, the consultation is near me. The common goals for us are number one, to avoid surgery, number two, to stop medications, and then lastly, we want an improvement in quality of life. However, how do we get there? Well, we want to ensure a few things, right? Number one, we all want a plan. We as patients, and of course, we as physicians, want to be able to deliver that plan for you. Number two, we want a plan to be safe. We want it to be low risk. We want it to have short recovery, and we want to avoid the pitfalls. Here's a couple of good classic examples that have occurred in our office that you might be able to relate to. Number one, we had a retired psychologist who flies airplanes for a hobby. He's a runner, competitive, but also did it for stress relief. Back pain ended his running career, so to speak. No more competition, fun, stress relief, and it really limited his flying time. Second, we've got a chef who really just enjoyed spending time with family, a little younger patient, but was in constant motion, moving heavy restaurant equipment. But this was affecting his work, difficult to get through the workday. And we're talking about him potentially contemplating changing careers. A lot of times the therapies that they were going for was missing the target. The traditional treatments that they were after were limiting. Number one, things like surgery meant things that were permanent, they were invasive, they had long recovery. And secondarily, there was things like medications. We all know the utility of steroids, but we also know them as Band-Aids, where they can weaken, they can damage tissue. So meaning that if you repeat the steroids, you're often causing repeat weakening and repeat damage. Over-the-counter medications, sure, great, can certainly lessen the symptoms, but unfortunately, those effects wear off and you have to repeat the dose all over again. 2 months after our stem cell therapy process, the psychologist was back to running. Ran the 4th of July 4-mile race, ran a 13-minute pace, wasn't his favorite, but was happy to do it. Gave him enough confidence actually to train for a half marathon with his grandson, and actually just checked back in with him a couple, maybe a month ago, and he'd actually completed it. The chef was back at work doing full-time work and was able to provide for his family, was able to get back to what he needed to do. For us, it's this cycle, and it's how we go about breaking the cycle. It's pain leading to degeneration, then therefore more pain, more degeneration, and then this constant loop. What we are is really the third solution, not medication, not surgery. What we can offer you is a high success rate, something that lasts years of relief. And more important in all of this is that there's this guaranteed acceptance. It's your tissue coming back into you. You cannot reject it. There you have a graph of what it's like for a lot of our patients. It is this constant, progressive improvement where after 4 weeks, people begin to see the initial changes, and then for the several months after, getting progressively better. So what exactly is regenerative medicine? Well, regenerative medicine is a new field of medicine. The function here is to restore and not replace what you were born with, what you've already got in your body. We're taking the damaged tissue and turning it into a healthy, functional tissue. The different materials primarily used to restore this include, number one, platelet-rich plasma, and number two, stem cells. Sometimes we get the question, well, should I do platelet-rich plasma? Should I do stem cell? Platelet-rich plasma is a great therapy where you're in the green or yellow circle, meaning mild or mild to moderate problems. But once you hit that sort of moderate to moderate severe problems, we're talking about the utility of stem cells. So it's a lot of the same application to problems, but depending on the severity. Here's a good videoed example of what it's like to have cellular activity attacking a damaged area. Green is good, red is bad. This is the red, it really represents what's pain and stiff and causing sciatica and nerve pain and all of this sort of symptoms that we often feel. This is one of my favorite analogies for this because I think this is a pretty good accurate depiction. If we look at the Pac-Man problem and solution, the pellets are the inflammation. Pac-Man eats pellets one at a time, and that's how you get through the game. And if you could imagine that's what PRP is, then if you put many Pac-Man all at one screen, all at the same time, that's what the idea of stem cell is. And the goal here is to not get to the next level, but to beat and leave the game, the problem behind altogether. How long can we leave it behind? Anywhere from 5 to 10 years. So where exactly do these cells come from? For us, one of the primary sources of the stem cell is bone marrow. And in that spinning pelvis, you see the posterior ridge right there. And you can see that ridge where we'll be removing the stem cells and place it back into, say, for example, a degenerated disc, and efforts to restore it back into normal use and function, and obviously less inflammation, less pain, and a better quality of life. For us, a lot of our stem cells run through this type of timeline and protocol. First, we like to do a consultation. Soon thereafter, we like to have the MRI. We then like to utilize the first platelet-rich plasma. The second platelet-rich plasma also has the introduction of the stem cells. Lastly, we have the third PRP, and from there we add physical therapy, chiropractic care, exercise, and restore you back to some improved strength. So what exactly can we treat? Who can we treat? What sort of problems can we treat? Stenosis, arthritis, degenerative disc disease, and sciatica, particularly of the neck and back. Well, when it comes to lower body, we can do things like arthritis, bursitis, meniscus problems, and the Achilles tendon. For the upper body, absolutely rotator cuff, arthritis of the shoulder, tennis elbow of the elbow, obviously, things like carpal tunnel, even into the wrist, even thumb joints in the hand. A lot of people like to ask, well, am I a candidate? The way we think about this is that whatever that can be injected with steroids can be treated with stem cells. Anything that is operable can be treated with stem cells. So as a matter of the thing to try first, absolutely. What's important for myself and our office and our practice is diagnosis. For us, having the accurate diagnosis really means that not only do we have the accurate location, but then we can then be certain that the therapy is then going into the right spot. For us, our therapies include an MRI. We have an MRI in our office. We're one of the few offices, if not only office, to be able to offer that. So for us, we're serious about the accuracy. We're serious about the processing of the cell, and we're also serious about getting the accuracy of cell placement. So what if you've had surgery? The answer is yes. However, we really encourage that first consultation. For us, it's important, again, getting the diagnosis and the imaging that might be involved in order to help us determine exactly, can we help you? How well can we help you? To what degree of success can you expect? Not all spine surgeries are the same. And so it's important to know all this. History and exam during that consultation will be key. And of course, the type of surgery, whether it was an arthroscopy, did you have a fusion? Did you have a rotator? Some frequently asked questions. Number one, where will my stem cells come from? So you saw the spinning pelvis, the posterior of that pelvis. It is not your spine, it is the posterior of your pelvis. And that's the primary source we utilize from. For a lot of arthritis of, say, for instance, the knee or the hip, we're also using stem cells from fat. So we extract from a number of different locations based on what we're treating. How long before I can become active? So you saw from the stem cell PRP to the next PRP is a 4-week window, and then immediately after that, you're free to be active. So we ask for a 4-week holdback on any significant activity. No long walks, no heavy lifting is what we typically say. So when do you feel the benefits? So the majority of our patients will feel a benefit within the first 4 weeks, but it isn't maximal benefit. What's going to happen is at 4 weeks, you'll feel a change, at 8 weeks and 12 weeks, and progressively better. We've had some people go as many months out in order to see that peak, which is always exciting for us to see people get continued benefit. How long will the tissue stay repaired? We talked about anywhere from a 5 to 10 year window. I would say probably 5 to 7 for a lot of joints, 6 to 10 for a lot of spine and neck and disc-based issues. And of course, how well this works. And of course, this works. And of course, success rates are important, but this is really individualized. It's what is it that you're presenting with, and how significant is your problem, and how debilitated are you? How much physical therapy are you going to need? So we have a good assessment, but that consultation for us is an important piece to all of this. So this is the part we're going to launch into questions and answers. And so if you do have questions, feel free to start typing them in now, and we can discuss them at the very end. This first question comes from Bill and Maria W. from area code 607. I have stenosis and DDD. And that was a question from Bill. Maria asked Anthony about chronic lower back pain and DDD. So the DDD is degenerative disc disease. And this is essentially where you have the slow leak of the jelly out of the donut. When the jelly leaves the donut suddenly, we call that herniations. But this slow leak is what we call degenerative disc. Here in that circle, you can see where the blue disc is. And as material pushes out and backward, it's going to push near what that yellow pod or that yellow river or wire, or however you want to describe it. As that gets close, that's essentially creating stenosis as it pushes into that canal there. Stem cells for us means by placing it into the center of the disc, we're helping that donut hang on to the jelly, which means improvements in pain, which ultimately mean better activity and exercise tolerance. Marilyn A. from 518 asks about abdominal trigger point injection stem cell therapy for back pain. So abdominal trigger points is really a sort of separate topic, but I'll touch on it briefly. It's one of our tools in our tool shed. I say tool shed because I think what we have is much bigger than a toolbox, but it oftentimes addresses trapped nerve. Stem cell therapy for back pain. For us, it's an issue where in degenerative conditions, it's often getting worse, not better. And therefore, being able to do something like the stem cell therapy is really about resolving that pain and giving you a restoration of function and improvement in activity. Patty B from area code 518 says, I have SI joint issues and all low back pain generated, looking for non-surgical recommendations. So unfortunately, when it comes to the SI joint or the sacroiliac joint, the surgery for that is something called the fusion, and where they sort of lay a bar across all three of those elements. So not only the left and right ridge, but along that center bone with the holes in it itself. It's a pretty significant surgery, and it forces it to or prevents it from bending, which is sort of what you need. Our approach really is to strengthen those ligaments. We treat the arthritis, and through that, if we could create an atmosphere of less pain, stronger ligaments, it ultimately means a stronger connection between the upper and the lower body. And then obviously that will give you a much less pain sensation. And when you do things like bending and standing for long periods and walking and all of that. Alger, C from area code 518 asks about sciatic pain relief. So sciatica is something we see quite often. We often have pain, and the path to finding that pain solution is not always clear. And when we talk about something like sciatica, especially, we want to not think about surgery. We sometimes dread surgery, but we all know that looking for that solution while you look for that solution means that you can be losing your quality of life actively. Sciatica is complex. There isn't a single solution always, or a single answer immediately. It really requires that consultation where I get to explore both your history and the physical exam and really find out where that source of that sciatica is coming from. So it really is sometimes a step-by-step process. Sometimes it can be done in one consultation, but it's important to start that process. James L. from area code 208 asks, if you've had multiple back surgeries, all lumbar vertebrae, that's what the L stands for, are fused, will the stem cell and PRP still work for the next vertebrae, which are the T's? He means the thoracic levels that are starting to give way. So this is one of our favorite topics, in that people who have had surgery then start develop. If you've had surgery, you've had fusion of multiple levels. That means the level above or the level below then start losing their ability to withstand flexibility, and then leading to disease. Unfortunately, fusion means not allowing those bones to move forever. And we've been quite successful in being able to offer people a lot of pain relief at those adjacent segments, and sometimes even with the segments within the fusion. But absolutely, even if you're fused, therapy, success, pain-free living is possible. Sherry C. from area code 518 says, I had a fall 13 years ago, and at the time went to an orthopedic doctor, and he said I was fine. I have pain in my lower back on both sides, and now it goes down to my legs, but only while lying down. Just want to see if that is something that could help me. So really, trauma can activate a lot of degenerative conditions. It can activate a lot of pain environments, and we've seen it time and time again here, and especially where we live. We have a lot of horseback riders and horse community. So a lot of people falling off of horses, thrown off of horses with triggered pain, and then continuing. So for us, it sounds like, Sherry, you may have an element of sciatica, and that consultation would certainly be the next step. But your scenario in particular, where people have had pain triggered by a fall, absolutely something we've been able to help in a lot of patients. Allison C. said, area code 570, stenosis, degenerative disc disease. I've had 2 back surgeries. They were fusions, and I suffer with terrible sciatic pain. It's been about 3 weeks now and nothing works. So you've had a lot of the minimally invasive, and now it sounds like you've even had the most maximally invasive with fusion. However, when fusions fail, the non-invasive things typically don't help. So you're left with looking at fusion and then what to do next. And unfortunately, for a lot of people prior to regenerative medicine and stem cell therapy, it just meant more surgeries. So even if you've had fusion, like I said before, we've been able to help. Really would love to see what your images look like, listen to your story about your course with the stenosis and the degenerative disc, but absolutely something we can help. Peter F. from area code 845 says, I have herniated discs in my back, which affect my leg and foot pain and tingling and no feeling. Would like to know if these procedures can correct this. So we were talking about the whole jelly donut idea before. And of course, herniated discs then lead to degenerative disc, and degenerative disc leads to increased risk of herniation. So for you, you're sort of caught between these two sort of processes that are going back and forth. I certainly recommend a consultation to help us learn the extent of what sounds like nerve damage. Two things matter to us: the time you've had the damage, meaning how long has it been going on, and secondarily, whether you have what we call a wax and wane component. Sometimes it's there, sometimes it's not there, or is it there all the time? These are some details that we need to know in order to accurately assess whether we think those nerves will recover. Ralph B. from area code 904 says, I have a left knee, which is very painful and has been diagnosed as osteoarthritis. I'm sorry to hear that, Ralph. I've undergone physical therapy, which did not help. A longtime friend who is a patient of Dr. Kim, Dr. William Long, suggests that I contact Dr. Kim. I live in St. Augustine, Florida, and will be visiting Dr. Long on June 10th. Appreciate being able to see Dr. Kim at the time. Pacemaker, difficult to have an MRI. One done in June of 23, can bring those results. Thanks for your help, Ralph. So it sounds like if you have osteoarthritis, this is probably the most common diagnosis we see in our office for knees, hips, shoulders, certainly of the spine as well. If you do have an MRI for us, a disc is incredibly helpful. Obviously, getting a new MRI with the pacemaker can be a little bit challenging, but certainly the prior imaging, if you've got, helps. We work with people in all their travel schedules, and you saw that we will require multiple injections in that case. But we've had patients from France, from Montreal, from North Carolina, Buffalo, Central New York, and beyond. So we've had people from all over, and Florida really is not any different from anybody else traveling. Both Wayne V from area code 802 and Diane L from area code 802 asked some similar questions, so I'm going to try to answer them together. Wayne asks, I've tried everything, a bunch of different chiropractors, injections, decompression, nothing seems to work, need help. Diane says, how can this work for older people with degenerative spine and stenosis? So really it's about the diagnosis. You have back pain in Wayne's case, but I want to know what exactly your diagnosis is. Diane, on the other hand, has some idea that she's got degenerative spine and stenosis. I'm going to assume that Wayne is talking about a degenerative condition. What I want to say about degenerative conditions is that we know that year after year, it gets worse. We know that this year is worse than last year, and we can probably guess that next year is going to be worse than this year. It's kind of like that building that I have in the background. If nothing is done, no upkeep is done, then this building, this spine, this arthritis is only going to get worse. Especially if you've gone through something like chiropractic care, which is the non-invasive method, and I certainly recommend anybody who hasn't gone through something like that and is considering that to try. But the next step after that is something what we call minimally invasive, and that is where things are done with needles, with injections. And which is exactly where we come. Okay. Tina S. asked from area code 518 and Al S. asked from area code 905, how does PRP differ from stem cells and how long does it take for tissue to heal with both? And Al asked, procedures for knee pain and slip disc. I've had 2 PRP shots in my knee and still not feeling 100%. So to Tina's question, so PRP is a much quicker process, a much easier process. In our office, within an hour, we're pretty much done. However, the downside of PRP is that it's oftentimes shorter lasting. Stem cells is a process that requires much more of your time, much more involved, but it is something that we see much more longer lasting when it comes to outcomes. And obviously, stem cell is something we help with more severe problems. So if the severity of the issue goes up, we're often looking to stem cells to be that solution for us. The time for the tissue to heal depends. Really depends on the fitness level of the patient, what their nutrition status is, whether they adhere to our instructions and our physical therapy protocol. In general, you can sort of see the beginnings of the healing process happening within the first 2 to 4 weeks. You have to keep in mind we're utilizing cells, and when you utilize cells, it's everything we can do to make sure that those cells stay alive and healthy. When those cells deteriorate or are destroyed, we've lost our therapy. Now on to Al. When you're talking about slipped disc and knee pain issues, for us, very common symptoms. Again, I'd like to know the diagnosis. So knee pain, is it from arthritis? Is it from meniscus? It's an important thing. So you've had 2 PRP shots. However, for us, when we're talking about especially stem cell-based therapy, it's not just about PRP in the knee and then done. What we're utilizing, especially in places like the knee, is we're utilizing what we call intraosseous injections, where we utilize both the stem cells and the platelet-rich plasma and attacking the cartilage from both above and below. So our process is a little bit different, and I'm not surprised if you've had a single PRP, it hasn't been completely effective. Amy from area code 315 asks, seeking treatments for spinal lumbar stenosis. Patient is my husband. Stenosis means narrowing of the canal for us. So if you look at the spine picture there, the blue is the disc, and then obviously the red surrounding is the spinal cord, and the yellow being the nerves. So when the blue sort of encroaches and pushes down onto that region of yellow and red, that's really what stenosis is. It's unfortunate because when stenosis does occur prior to what we do, there weren't a lot of treatment options. Things like steroids, things like traditional therapies have not been very effective. For us, we're seeing a high degree of success with stem cell therapy in the region of stenosis and in the areas of stenosis. And I'd probably say it's one of the top 3 reasons we treat somebody in their spine. Lynn B asked from area code 518, do you do stem cell replacement on thumb joints? Yes. So it's a very similar process to that 3 injection protocol you've seen in the past. Of course, MRI is still important for us. It is a very frequent diagnosis. And of course, if you've ever explored the idea of surgery, they basically operate to remove a bone and then roll up a tendon to be placed into the joint as a replacement. But it's a fairly long rehabilitation process. And for us, we're getting people back, somewhere between 4 to 8 weeks. Jacqueline D from area code 514 asks more information about how these treatments can help with degenerative issues and injuries such as spondylolisthesis and hip pain. So for us, when we talk about a spondylolisthesis and hip pain, we see them oftentimes travel together. So spondylolisthesis is where one vertebrae on top of another vertebrae is not perfectly aligned and they've shifted. And a lot of people with this have degenerative issues to lead to the slip, and then therefore not surprised that they have arthritis in their other areas. Certainly for us, we apply a lot of stem cell therapy for these two particular problems. It's obviously a different problem. It's a different process. What we do for the hips and what we do for the spines. A lot of people will ask, well, what should we do first? If all things being equal, we like to do or we like to treat the spine first. That really helps us work on core development. And obviously, if you work on core development, then doing something about the hip becomes much easier. Rita H from area code 518 asks treatment for spinal stenosis, degenerative disc disease, osteoarthritis of the lumbosacral spine. So for us, talking about stenosis, it's important to understand that stenosis really is a tunnel. And if you can see the tunnel in the background, the nerve passing through the tunnel really is like the train coming through. For us, the disc is holding that tunnel open. That means when the disc degenerates, your tunnel is collapsing and onto that nerve, onto the regions of pain. But it's obviously something we do by treating the disc, treating the osteoarthritis of the spine. Scott R. asked for area code 315, an MRI that was done indicated I have spinal stenosis in the lumbar region. Received 2 nerve block injections with very little relief. I'd be interested in learning how regenerative medicine may help this. So just like I was saying before, so stenosis, when people have it, the traditional therapies like steroid injections don't do a whole lot, unfortunately. But for us, this is something we do treat and have had an incredible amount of success with, and are quite happy with the results with how we do it and the end result for people, and especially being able to give them their quality of life and being able to return. For us, it's really by restoring the disc quality through stem cells. We're helping people achieve anywhere from 6 to 10 years of really long-lasting relief. And again, for us, a fairly common diagnosis. Russell H. from area code 315 says, I am told that only surgery will cure my pain, but I do not want to have surgery. So I'm curious if this will help, as well as the cost, if I can really afford it. I'm retired and on a very limited budget. So pain, Russell, I understand that you're having pain, but for us, we really need to know where is that pain coming from, what sort of diagnosis. For example, in the knee, is the pain coming from arthritis? Is it a meniscus tear? Do you have a ligament issue? This is some of the important parts of the information for us. But we don't particularly feel that pain needs surgery, or that pain can only be resolved with surgery. And you know, the success of our practice probably says that that's not always the case. We'd like to know where the pain is. And obviously the cost for us is not something we can simply say just because you have pain and you know what the cost is. For us, it really varies. But if you go through the consultation, we can provide you with all of your options and find the solution that'll work for you. Larry asked from area code 315, if I already have a recent MRI, do I still need to get another? Does med insurance reimburse for stem cell therapies? And does stem cell therapy work for 70+ individuals? Great questions. So if you've had an MRI, it all depends on how recent it is. We want to work with the most up-to-date information as possible. So for us, we build getting an MRI into our protocol. And when I say get an MRI in our office, and we have one just across the hall. And so we can coordinate all of that in one visit. There's a couple of exceptions where we won't use an MRI. So if you've had an MRI, say within the last couple of weeks, that may be enough. We just saw a gentleman today who had an MRI a couple of weeks ago, but didn't like the quality of the MRI. So we're going to have him run through our specific protocol that we like for our stem cell patients. Unfortunately, insurance doesn't reimburse for stem cell therapy, and as much as we go blue in the face, asking and pleading, yet to have that happen. Lastly, age is not a factor. We've had patients as old as 90 plus go through this. So being 70 plus, for us, you're still at the age of spring chicken. Michael N. from area code 518 said, can stem cells help fix my back for possible arthritis or slipped disc? Had an MRI done, seen 2 doctors. One said I had arthritis, another said I had slipped disc. Also, how fast do stem cells work? If I am working during the seminar, is there a way to listen after? So we talked a little bit about that spondylolisthesis, a relationship where one bone is slipping in front of the other. What I haven't said yet is that the disc underneath that slipped bone then is what's really driving a lot of pain. And of course, that then can lead or be accelerated by arthritis, or arthritis can accelerate that pain process. When that disc gets exposed like that, what we're seeing is that it does worsen the arthritis. So for us, having, whether we call it arthritis or slipped disc, are pretty similar ideas. Excuse me. Again, results typically start within the first 4 weeks, but it is something that is progressive. All our seminars are recorded and can be found on our webpage for future viewing. Zane G from area code 315 said, I live with severe back and leg pain, numerous operations, had a spinal stimulator trial that didn't work, looking for relief. And you were told to contact myself. So for us, it's important to know that, for you as a patient to know that spinal stimulator does not disqualify you. Surgery does not disqualify you. We've had many, many patients with similar procedures done in the past and go through our process and still have a successful outcome. And some people saying that, of course, I wish I found you first, but that's neither here nor there. You have pain, you're looking for a solution, and we may have just the one for you. It's important, though, that we get through that consultation for us to explore not just your history, but your exam, your imaging, and also what sort of goals you're looking for. Are you looking to run a marathon? Are you looking to be able to walk your dog at night? Are you looking to travel with your family? These are the sort of things that also help us relay to you what is and what isn't possible. Nathan F. from area code 202 said, interested to learn more about stem cell procedure for sciatica and back pain. Again, back pain, sciatica, quite common for us. Obviously, so as you can see from all the prior questions, it's reasons that people come to us with very successful treatment outcomes. We're non-operative. Everything is done in office. We're talking about very short recovery. We're talking about very little risks. We're talking about using your own cells. It's not from a lab, from a jar, from a vial. It doesn't come off the shelf. It's all you. Henry R. asking from area code 315. So you're having backache with nerve pain. So this is a good question. When is backache not just a backache? And I think the involvement of a nerve makes it say that, look, there's a little more going on here than simply back pain. You're getting nerve irritation and maybe perhaps a more significant degree of pain. Talked a little bit before about both time and nerve damage. The more time elapses, the more the nerve damage can become permanent. And so we like to have that consultation soon and then provide therapies earlier rather than later. Damon K said, I'd like to know whether stem cell treatment can help a herniated disc, a slipped disc in the L4, L5 region of the spine that is causing mobility issues and discomfort in the lower extremities of the legs. So again, yes, very common scenario. We treat slipped discs, especially of the L4, L5 region. That's a very common spot that we see. And for whatever reason, the body mechanics or the anatomy in our human bodies tends to present there quite often. Sciatica issues, it sounds like that may be part of it, especially if you're getting discomfort in the lower legs. You know, what we have is non-operative. There's no long-term medications. There's short recovery. So a lot of good reasons to explore this as a reasonable alternative. Denise R says from area code 315, how regenerative therapy helps degenerative disc, facet joint hypertrophy, fibromyalgia, and osteoarthritis. So this is an image that I like to point out when we're talking about both how discs degenerate and then therefore how do we go about undoing some of that. So if you look at the red circle, that's the cartilage end plate. So if the bone above it touches or sits on that cartilage end plate, the disc below it is the 1, 2, 3 relationship. The nutrition of the disc happens through the cartilage end plate. I'm going to say that again. The nutrition of the disc happens through the cartilage end plate. There isn't a direct blood vessel that is entering the disc, providing it with nutrition. What you get is you get all the nutrition passively. So therefore, when it's injured or degenerative or deteriorating, sometimes there's not enough nutrition coming through. Well, that's where the stem cells come in. When we can place stem cells directly into the center of that disc, we are jump-starting that nutritional process. It is forcing nutrition to come through and helping restore that environment. Ultimately, what we're looking to do is by creating a new environment, that means less inflammation, less pain, and better life for you. Joanna R. from area code 518 asks, neck pain that travels down the arm, hip now hurts at different times. Is this a spine or different issue? Previously diagnosed with compressed discs. So you have what is called radiculopathy. That means there's a nerve irritation and there's that nerve irritation is happening down a path. And of course, that path can lead all the way to the foot sometimes, to the calf sometimes, to the back of the knee, to the back of the leg, or just simply the buttocks. But you really got to get that nerve irritation down to at its source. And if you know that you have compressed discs and then therefore degenerative disc disease, then very well likely may be where this is coming from. So being able to address the disc will help address the sciatic. Hip pain versus back pain is one of the more common overlapping diagnostic challenges in our office. For us, that consultation is key. That's where we take the symptoms plus the history of your symptoms plus the exam that you and I get to do will result in that successful consultation. Yeah. I think that was the same question. Okay, so Sean M. from area code 828 asks general information about Dr. Kim's methods and what does it cost and does insurance cover it? So what's important in our process and some information for us is that we really believe in 3 keys. And the 3 keys are to have high quality diagnostics, high quality processing, and high quality precision-based injections. And over the last 10 years, this is really what we've developed and what we've really become good at. And so this is, for us, what we think is the most important. So successful stem cell therapy is not just about the stem cells. It's about the whole, the whole boat, the whole banana. Cost is quite individualized. So what you have, Sean, and somebody else has, quite different and maybe a different cost. So very difficult to give you an idea on something like that. But obviously, then consultation is the key element. Maureen from area code 607 said, interested in possible stem cell injection for osteoarthritis of my knee. Again, osteoarthritis, quite progressive. It's degenerative. You know, next year, 2 years, 5 years from now, it's only going to get worse. Stem cell therapy, in particular for knee arthritis, is probably one of our most frequently done procedures. We did 2 just today. So give you an idea of how commonly it presents. Tammy from area code 518 says price and how to purchase stem cells. It's not a product. It's not something that can be purchased. It's a whole process. Again, diagnostics, prep, processing, placement. And this really has to do with your physician. So maybe you won't come to me, that's okay, but make sure that you're understanding that your physician, whoever you're going to, has both the ability for the diagnostics, the experience for the processing, and the skill for the needle placement. So that those are the really key elements. Denise from 315 said, simply more information on this new avenue of treatment using stem cell therapy and if it's covered by insurance. Hopefully we were able to answer a lot of your questions for you, Denise. But ultimately, insurance does not offer coverage for this, not yet. Hopefully, so maybe one day, someday down the line. This just is an option. It's an option from surgery. It's an option from physical therapy, especially when some of the non-invasive things are no longer working. Okay, so the future for us here. What to do, what happens next. So anybody who's attended today's webinar, I'd like to offer you a free consultation. The catch is that you have to call by this Friday at noon. You have to mention that you were here at the webinars, and then obviously schedule a consultation. For phone numbers, 518-871-9900. For our Canadians, it's 514-697-8919. You can find this at richardkimmedicine.com. Obviously, you're on here for the webpage. Future webinars and prior webinars is at /webinars. And if you're interested in starting with the MRI process first, certainly that's reasonable as well. And you can find that at /MRI. We'll have a new June webinar date to be posted shortly. So keep on the lookout for that. And actually, it should go up as soon as this webinar ends. If you have a question, now's a great time to ask through the Q&As. Okay, so we have our first question here. Dan is asking, how long is the procedure? So great question. So there's typically 3 portions when we are doing the stem cell process. The typical length of time is between the first and the third injection dates. We need about an hour of your time. The second injection date can range from anywhere from about 3 to 4 hours. Again, it depends on whether we're injecting the low back or the knee or the shoulder. Different injections, different areas require different amounts of time. Maria is asking, is the MRI included in the consultation? So once the consultation happens and you have decided on this as the process, the MRI is in fact included. It is all, for us, it is part of the process. I should also say, Maria, I'm glad you asked it, and as I'm thinking about it, if you decide on the MRI first, the consultation is then free afterwards. Okay, so it sounds like the meeting room is emptying out a little bit here. If anybody has any future questions, happy to, have you guys in consultation, and to go over the questions in person. Otherwise, I hope you guys have a good night here.